So good morning, everybody. We're just going to give a few more minutes to let some more participants in. So thank you all for joining us. We'll get started in just a little bit here. Okay, everybody. I think just in order to respect everybody's time, we'll go ahead and get started today. So good morning. My name is Brian Boyce. I'm a head and neck surgeon in the Winship Cancer Institute at Emory. And I just want to thank everybody for taking the time out of your busy day to attend this webinar developed by HPV Cancer-Free Georgia and the Georgia Cancer Control Consortium. I serve as one of the co-chairs of the HPV work group, along with public health experts, Dr. Gabrielle Darville of Mercer University and Adrienne King of Rollins School of Public Health at Emory University. We're really excited you have joined us for our first annual HPV Awareness Day in Georgia. This event coincides with events and collaborations around the globe taking part in International HPV Awareness Day this March 4th. The goal of today is to bring attention and awareness to HPV prevention, diagnosis, and treatment to reduce the burden of HPV-associated diseases and cancers. We have a full agenda, and I'm very excited about the lineup of experts we will be hearing from today. I'm especially thankful to our cancer survivors who have agreed to share their moving stories and journey through cancer diagnosis, treatment, and survivorship that reveal how HPV cancers impact people's lives. As a reminder, this event is being recorded and will be available online through the HPV Cancer-Free Georgia website. Please reference the agenda that was included with the registration for an outline of the webinar. All right, so next slide. And next one. Oh, we think we missed the question there. Is there a question? So bear with us, please. This is we're still getting used to the technology here. So we'll go ahead and get started here. So to give you an idea of the global impact of human papillomavirus, it causes 6 different types of cancers. It is responsible for 630,000 new cancer. Oh, sorry. We have, sorry, this is our question here. So if you can go ahead and vote either on your phone or on your laptop or computer, that would be great. So the question is, what is the most common cancer caused by HPV in the United States? So go ahead and vote. Give a few more minutes here. Thank you, everybody, for bearing with us. Saying that the host and okay, well, again, sorry about the technical complications there, but just so you know, the correct answer there was oropharyngeal or head and neck cancer is the most common type of cancer caused by HPV in the United States. So the oropharynx is an area within the throat where the virus causes cancer. And if you're wondering why a head and neck surgeon is involved with HPV prevention work group, this is why. Each week, I take care of patients that are undergoing or have been treated for HPV-associated head and neck cancer. And then, so, and again, leaving where we left off. So HPV cancers caused by the virus are truly a worldwide problem. HPV causes 6 different types of cancers, and it is responsible for 630,000 new cancer cases per year globally and nearly 36,000 new cancers per year in the United States. It is estimated that HPV cancers claim the lives of 475,000 people per year, which, if you do the math, is about 1 person passing every minute. To reinforce the impact of HPV, I took this quote from an article in a prestigious academic journal where the authors state, "It's time for the world to recognize that for decades, HPV has caused a slow-moving health crisis akin to a pandemic that is hiding in plain sight. We have the science and ability to prevent HPV cancers from starting, so we should be using them and making them available to everyone." Next slide, please. So as we said earlier, head and neck cancer is the most common in the head and neck. More specifically, HPV primarily affects the oropharynx or back of throat that includes the tonsils and the base of tongue. Most people know what their tonsils are. The base of tongue is an area that people can be unfamiliar with. It is not the front part of the tongue or the part that you see when you open your mouth, but it's the part of your tongue farthest back, behind those bumps, called the circumvallate papilla. It's a part that's difficult to see through the mouth, but it can also develop cancer from HPV, and it has similar tissue as the tonsils on the sides of your throat. Next slide. The most common HPV-associated cancer in the US occurs primarily in men, who represent about 90% of the new patients with HPV oropharyngeal cancer. This is a big shift because when most people think of HPV and cancer, they think women and cervical cancer. Now men are most at risk, and that is why it is important to make sure both our girls and boys, men and women, get the HPV vaccine. While traditional risk factors for head and neck cancer are smoking and heavy alcohol use, HPV head and neck cancer patients are unique in that most people who have them do not smoke and do not or use very little alcohol. Furthermore, these tumors rarely cause significant sore throat, trouble swallowing, or ear pain that are typical of non-HPV cancers. The most common presenting symptom for HPV-associated throat cancer is a persistent neck mass where the tumor has already spread to a lymph node in the neck. Next slide, please. The rate at which the number of new HPV oropharyngeal cancers has been increasing is staggering. Over the past decade, there has been a 225% increase in the number of new HPV head and neck cancer patients, and the numbers continue to rise. Unlike cervical cancer, there is no effective screening test for this type of cancer and many of the other ones caused by HPV. So the future of our young adults and adolescents is primary prevention. The treatment for HPV head and neck cancer is significant and can include surgery, radiation, and chemotherapy that can profoundly impact patients' life and well-being, both during treatment and after. Next slide. So with that being said, one of the most powerful ways that you can really understand the impact of this virus and the cancer is to hear someone's experience. I would like to introduce our first cancer survivor, Mr. Christopher Kopecki. Mr. Kopecki is joining us while on vacation. That's how dedicated he is to this cause. And we just want to thank him for joining us today and your dedication to promoting HPV awareness.
Brian, thank you very much. And, a very personal thank you to you for all of your care along my story. But, pardon me. I am 49 years old. I have lived a very healthy lifestyle. I've never been a smoker, a very light drinker, just as you indicated. And this was definitely a shock that happened to me. I'm going to start my story back in the fall of 18, only to kind of set the whole thing up, because I was sitting next to a new family at my children's school that had just moved to Atlanta. And it happened to be that the husband was an ENT, and we quickly became friends and started spending a lot of time together. I'm then going to fast forward about a year later from that, because I was all of a sudden my left ear would start kind of clogging up as if you were on an airplane. And I also noticed at that point in time that it felt like I had a small kernel of corn that was kind of stuck behind my left tongue. Just two unusual things, but didn't think a whole lot about it. So that was kind of the fall of 2019. And then in January of 2020, I was actually overseas in Europe and at a business trip, and was having meals, and noticed that when I tried to open my mouth, I was actually hitting my teeth with my fork because I actually couldn't open my mouth far enough to actually get my food into my mouth. And the reason that I bring up my ENT friend is I got back to the US and said, I'm going to go and see Dr. Andrews. And I probably wouldn't have done it otherwise, but it was just since I knew I had a friend and it was easy, probably as a typical male, I would have just not done anything about it. And I went to see Dr. Andrews and tried steroids. It clearly was something with my tonsil, tried some steroids, some antibiotics, and nothing responded. And so he suggested we do an MRI. So I did the MRI, and a couple of days later, he called me and said, "Hey, listen, I need you to come, grab your wife and come see me." And the MRI had identified that I had a 2-centimeter mass behind my left tonsil that was actually growing into my left jaw muscle, which was causing the trismus, or my inability to open my mouth. And so from there, we did a biopsy and did confirm that it was a squamous cell carcinoma, HPV-16 positive, and went from there to do a CT and a PET scan, and identified that the tumor the cancer had spread not only from the mass in my jaw, but also down into several lymph nodes in my neck, which, once you started looking at it, to Dr. Boyce's point, you actually could visually see that I had swelling in my neck, but was diagnosed with stage 4 cancer. And so that was in March of 2020. And as you can imagine, sitting down with my 3 children at that point in time, who were age 15, 12, and 8, was a pretty difficult conversation on the back porch. But my ENT friend quickly introduced me to Dr. Boyce. I spent some time with Dr. Boyce, and we determined that surgery was not an option just because of the location of the tumor in my left jaw and the fact that it was in the muscle. And so my treatment plan was to do 7 weeks of a combination of chemotherapy and radiation. So I did 7 doses of chemotherapy on a weekly basis. And then for 5 days a week, for 7 straight weeks, I had radiation to my neck in 5 different areas. And if you've never seen what radiation looks like on the head and neck area, as you know, there are a lot of very important organs in your head and neck. And so the process is you actually, they make a mask that covers your entire face and the upper part of your chest, that they basically kind of bolt you down to a table so that you cannot move, and then they administer the radiation to you. I was lucky enough to have proton radiation, which is a very new kind of cutting edge form of radiation that does a lot less damage to the head and neck area. But I was very lucky, and it was a long, arduous, and painful, 7-week treatment process. Through the process, you end up with some pretty terrible mouth sores. You end up not being able to swallow, being very difficult to eat. I had a feeding tube that I used through my treatments, but persevered. And by the beginning of June, I had completed all of my treatments and was on the road to recovery. And since then, I've had a clean CT scan, a clean PET scan, and we believe that all the cancer, has been eliminated. But there's always a chance that there's an extra cell that wasn't touched that could come back. And it's definitely something that you think about on a daily basis. I think about on a daily basis, and has definitely impacted, kind of my life in a very difficult way. But at the same time, I would tell you that, it's just amazing to me that there is a shot out there that can basically cure this cancer. So we're always looking for a cure for cancer. And these specific cancers, there really is a cure. There's a cure that keeps it from ever happening. And it's just amazing to me that that we don't see better utilization of the options that we have. So here I am, happy to be here, and I will absolutely dedicate the rest of my life and my financial resources and time. I'm currently a member of the Emory Winship Cancer Institute Advisory Board, and we'll continue to do events like this to try to really support and make sure that everybody knows what we need to do to solve this. The picture above is myself and my 3 beautiful kids taken by my beautiful wife. The day that I finished my radiation treatment, and you can actually see my mask that I'm holding. And that was a mask that bolted me down to the table as I took the 35 radiation treatments, and the wonderful staff that just really were by my side and helped me get through it. So I just appreciate you letting me tell my story. Thank you.
Thank you so much, Mr. Kopecki. That's very special, and it can be very difficult to kind of relive that experience and just put it all in perspective. And we really appreciate you sharing that with us today. That it's very personal, and it's difficult, but your story does help other people. And like you said, there is a way to prevent this. There's a way to prevent this cancer from ever happening. And that's why we're here today. So thank you again. So next slide, perfect. It's my pleasure to introduce Dr. Robert Bednarczyk, or as he's known to most of us, Dr. Bob. He is an assistant professor of global health and epidemiology at the Rollins School of Public Health at Emory University, and is a member of the Cancer Prevention and Control Research Program at Winship Cancer Institute and the HPV Cancer-Free Georgia Working Group as well. Dr. Bednarczyk research focuses on adolescents and adult vaccination, particularly addressing issues of vaccine hesitancy around the HPV vaccine. He has extensive experience leading and co-leading large research projects aimed at better understanding vaccine hesitancy and development interventions and strategies which may effectively alleviate vaccine hesitancies and increase overall vaccine acceptance. So today, Dr. Bob will be talking to us about the impact of HPV vaccination during the COVID era. So thank you, Dr. Bob, for joining us today.
Thank you, Dr. Boyce, and thank you everybody for having me here today. As Dr. Boyce mentioned, most of the work that I do is typically in the area of understanding and trying to improve confidence in HPV vaccination. We've done a lot of work across the entire state of Georgia to understand, really, talk to parents, talk to adolescents, talk to all of our leaders to understand what they think about HPV vaccination and what we can do to improve our coverage of this very important cancer prevention vaccine. However, over the last year, we've faced an unprecedented challenge in vaccine hesitance, and that's a new hesitance to attend well child visits during the COVID-19 pandemic. We've seen tremendous declines in the number of children and adolescents who are going for well care visits. In fact, in the early spring and the early summer of 2020, compared to the same time in 2019, we saw on average about a 30 to 40% drop in children and going to well check visits with their pediatrician. We've seen some rebound over the course of the rest of 2020, but we're still not where we need to be. And a lot of children are really falling behind in terms of their overall health and wellness checks, as well as their routine vaccinations. This is really concerning because with HPV vaccine, we typically see lower vaccine coverage than what is seen for the other routine adolescent vaccines, the Tdap vaccine and the meningitis vaccine. So as we see fewer children going in for well checks, as we see fewer children going in and getting their routine vaccinations, including HPV vaccine, this is just compounding this issue where We're just not getting as many adolescents vaccinated against HPV as we can. The situation for HPV, though, I think really is compounded by this lingering perception that the vaccine is optional, especially compared to other vaccines. A lot of that comes from the fact that HPV vaccine is not required for middle school entry, like it is like Tdap and meningitis vaccines are required in the state of Georgia and in many states. There's only a few states in the US that have a requirement for adolescents to receive HPV vaccine before they attend middle school. So this perception that this is an optional vaccine combined with much less attendance to pediatricians and fewer visits for well checks means that we're really facing the challenge of HPV vaccine rates starting to drop, and the gains that we have seen over the past few years, though not as large as we would like to see, we're at risk of seeing those gains really start to recede and leave potentially large chunks of our adolescents vulnerable to HPV-related cancers. So what can we do moving forward? Well, it's important to know that the pediatricians take the health and safety of their patients and the parents of their patients very, very seriously. So for parents who maybe have canceled previous well check visits or who are concerned about this, call your pediatrician, check in with them, see what the protocols are that they have in place to keep people healthy and keep them safe and protected from COVID-19. A doctor's first goal is to keep their patients healthy. And as we've heard and as we've seen, pediatricians, doctors all over are really putting very strong protocols in place to make sure that everybody who walks into their clinic is going to be safe, is going to be as protected as possible. And we need to utilize all of these possible visits to get children vaccinated. As now we're starting to move into the spring and soon into the summer months, this is the time that we typically see adolescents going for back to school physicals, going in for sports physicals. And each of these opportunities, every time an adolescent is going to see a doctor, we need to make sure that the doctors are taking that time to check all of the immunization records for that child and make sure that all of the vaccines that should be recommended are being recommended at that visit. This is a really critical time, as we move forward and through the year as we approach, the start of potentially, the start of another school year coming this fall. But as we continue to move through the COVID-19 pandemic as well. One of the concerns that we have is looking at the number of vaccines that the children may be getting over time. So, now currently COVID-19 vaccines are not licensed or recommended for use in children younger than 16. There are clinical trials underway looking at the COVID-19 vaccines for younger patients. But the current guidance in terms of co-administration of vaccines is that there should be a waiting period in between the receipt of any other vaccine and the COVID vaccine on both ends of the COVID vaccination, just to make sure that everything is working properly and we get the best immune response that we can from every vaccine. So if there's going to be the possibility of increased COVID-19 vaccine supply and the potential for increasing the indication for COVID-19 vaccines, we don't want this to become yet another barrier to children getting vaccinated against HPV. So that's why it's important right now for parents to really check with their pediatricians to make that effort to get their children in for well checks, to make sure that they're not falling behind, and to make sure that HPV vaccine is one of the vaccines that is given at these visits. Typically we think of HPV vaccine being recommended at 11 to 12 years of age, but it can be given as young as 9. So for younger adolescents, older children or younger adolescents, age 9 to 10, if they're going in for doctor's visits, this is a perfect opportunity for our pediatricians to start that conversation and make that recommendation to parents about the importance of getting this vaccine at at the earliest opportunity. So one of the things that we're doing within our research is, trying to, again, understand who's getting HPV vaccine and who isn't, and why that might be happening. And that's become a lot more complicated in the time of COVID-19. But this is an area where I think that we've seen some gains, we've seen some rebounding, and we need to keep on that. So, we ask that the pediatricians reach out to their parents, especially for children who may not have had a visit recently, and for parents to reach out to their pediatricians so that they can understand everything that's in place to keep their children safe. Because it's going to take all of us coming together to not lose those gains that we have seen in HPV vaccine coverage, and to keep pushing us forward so that we can meet the goal of keeping all of our children protected against HPV-related cancers.
Thank you for that talk, Dr. Bob. That was great. A 40% decline in visits where children would normally be getting their routine vaccinations is dramatic. And one of the things that I've learned through the work group with Dr. Bob and others is that we take for granted that the vaccination rates should just increase over time without anybody doing anything special. But that's not the case. In Georgia, the number of adolescents, according to the CDC, the most recent data shows that we're at about 50% of kids who have received the full series of HPV vaccine. Our goal is 80%. So we got a long way to go, and COVID has definitely set things back some, but with strong recommendations from pediatricians, pediatricians getting families back into the clinic, families making these visits to see their pediatrician before they go back to school, or family physicians. There's room for improvement, and with strong recommendations and people who are advocates for this, we will see those increases. So we need your help. Next slide, perfect. So that brings us to our second question. Which is, how many different types of cancers can be prevented with the HPV vaccination? So, I alluded to this earlier. Let's see if we can remember, give some time to vote. Again, you can vote either on your cell phone or on your computer. Get some results coming in, give it a little bit more time. Is it 2, 4, 6, or 8? Perfect. Y'all were listening. That was great. So about 2/3 of everybody said that it was 6, and that is correct. So the HPV vaccine protects against 6 different types of cancers. And of those 6 types of cancers, again, only cervical cancer has any sort of screening test currently. All the other cancers are diagnosed only after they've grown and have caused significant damage. So for those, the vaccine is the best way to prevent it. Next slide. Perfect. So next, I'd like to introduce Dr. Jose Rodriguez from Wellstar Kennestone Pediatric Associates. He's among the most well-known pediatricians in Metro Atlanta, having participated in previous state and CDC-sponsored immunization efforts, and is a previous Georgia Cancer Control Consortium HPV Champion awardee. Both he and his nurse, Laurie Abney, are passionate about HPV prevention and protecting their patients through vaccination. As a result of their efforts, Wellstar Kennestone Pediatric Associates leads the system in HPV adolescent immunization rates for both initiation and completion. So I'm really excited to have Dr. Rodriguez and his head nurse, Laurie, here joining us today to talk about their efforts and some novel ways that they've achieved these great results.
Thank you, Dr. Boyce, for your introduction and your invitation. This is Laurie Abney. I call her my clinical lead and my HPV clinical champion too. Thank you. I'm Jose Rodriguez, pediatrician with Wellstar. I also have other faculty appointment with residency programs and medical schools, but today I'm going to speak just about how pediatricians can do a better job. When I walk into a room, I have a frame of reference. Every time I walk into a room, I want to be focused on the patient's need. How can I best be an advocate? And for checkups, especially, this is a frame of reference. When I walk into the room, I'm trying to prevent this, what you're seeing here. It was alluded already, over 36,000 cases, all preventable, 100% preventable. About a third of those females, 2/3 female, 1/3 male. Most of that oropharyngeal, like Dr. Boyce described earlier, and about half of them inferior cervical. Next. And how does that look when people in our the participants in our room? This is the age group. Look, 49, between 30 and 40, these women are being diagnosed. Next. Males, 61. This is an amazing opportunity to prevent something. It's long term, but 61, you think about that, I'm 68. I feel fine, I'm happy. I've been so productive in my life. This is the time we want to build legacy, the legacy that is not money that you're gonna leave to your children and grandchildren. It's your wisdom, your experience, the love you've given them, watch them grow. Both of my girls are pediatricians, and I've been so happy to be able to be there for them. So the legacy, this is totally preventable. Next. Why this is, how can we prove that this is true? Look at hepatitis B. HPV vaccine is not the only cancer vaccine that we have. We have another one. We've been doing it for decades. Hepatitis B. Hepatitis B causes chronic liver disease, which is the reason why children get and adults get liver cancer. One of the reasons. And look at this. Look at the bottom line, the brown line, almost eradicated completely from decades of doing hepatitis vaccination. This is 2002, 2017, 15 years. This is possible. We're already conquering hepatitis B. Next one is conquering HPV. Next. And this is what we do in pediatrics. Pediatrics is the only specialty that looks into the future, along with family medicine. The best place to exercise primary prevention. And look at the recommendation. I'm highlighting here what happened with HPV vaccine. It became available in 2006 for females, and then the ACIP panel recommended for boys in 2009. And however, there's a footnote. Next. The footnote, I want to point to you to the multi-spike star, 9 years. It's indicated starting at 9. And look all the things that we have to do. It's not just immunization. We have to screen for depression, anxiety, mental retardation, autism, child abuse, substance use, a lot of things to happen in 15 minutes. But as you see, 9, 10, 11, this is the time of their life to get their vaccines. Next. And how good are we with other vaccines? Well, this is meningitis. Meningitis for during a period of 2.5 years, 16 practices. We participated in a project for transparency purposes and to help each other with best practices. We're already doing an amazing job with meningitis, especially the first dose. So we are good at in vaccination. What happened with HPV? Next. Well, maybe not so good. Look at the different practices. Where are they? I point out the check mark is on my practice. For years, we implemented some strategies for years, and we identify what works best or not. If you notice here, 2015, this is old data, but it's to show you the sustainability when you introduce good practice, best practice. And how could you still improve? We are the second largest, out of these 16, we have the second largest teenagers vaccinated, 1,565 over that 2.5 age period. Next. If you were to compare that with the completed the series, remember this is prior 2017 when the recommendation came for 2 vaccinations under age 15. So if you notice, we in January 2015 when we measured this, we were doing good, but we could do even better completing the series, and we implemented even more strategies. And look at the results. Next. One of the strategies was to identify missed opportunities. So that put in place another PDS cycle of improvement. You have a hunch, you have an idea, let's test it. And then with the help of Lori and the team, front and back, every single visit, we identify every single visit with pre-planning, huddles, and look at the results. From 28% January the 1st, in just 2.5 years, we were able to cut down by July 2017 to only 10% missed opportunities. That means that 90% of the kids who needed a vaccine and they came for something else besides their checkup, got their vaccine. Next. So the changes that help us in 2017, the recommendation before your 15th birthday to have 2 dosages helped tremendously. It's a better self-thought patterns. Immunologically, the best time to get the vaccines, the younger you are. I hope one day we can give it a birth, just like we do with hepatitis B. But of course, the ACIP committee also voted to made the recommendation extended from 26. It was approved originally from 9 to 25, but 26. But people after 27, they needed to complete complete what they started. The recommendation came back 10-4 in favor of extending to 45. So you can still complete even though the presentation for these cancers are a little earlier. Next. This is an example of how does it look to do pre-planning. Very simple. The day before, we pull everybody who's coming to the practice. You can see 100, 150, thank you, a day in this practice. Maybe half of them are teenagers. A good number require vaccination. So this is an example. They come here for a checkup. Well, we're going to do the first HPV at 9. If you look at the second page, it says, yes, it's approved. You can give it at 9. We started in this country back in 2006 with the idea that, well, parents are coming, it's a rite of passage. 11, middle school, you go to get your meningitis vaccine, introduce it, then later the boys. Next. And this is what happened. Checkup, not only checkup, sick visits. These are, even for follow-up, this is a refill of medication for ADD, take advantage. And then the other one that we discovered, to your right, you'll see what happened when the visit is over. We don't let the patient go. That immediately we make the appointment for the next visit. Next. So I'm going to give you, leave you with 10 strategies that we use over the years. Pre-planning visit and daily huddles to work with the staff. Sometimes we have a turnover. New staff come, they need to be trained. We all have to have a well-oiled machine for our workflow to be productive, be efficient. We're focused on the patient, meet their needs. And when we are in the office, in front in the moment of truth, one-to-one, at that moment, the recommendation is a strong recommendation. And we do it on every visit that we need to talk about it. Taking time to answer the patient's question, education, demystification. When it comes for I'm going to talk about being a champion. I'll tell you what happened with education, even for the physicians' education. Implementing standing orders and procedures. Work on your policies, processes, and procedures. And that will, continuous improvement will help you achieve goals that you set to achieve. Patient reminders. Now with technology, it's amazing. I get text messages on my phone, phone calls. I start recommendation early. A 4-year that come for kindergarten immunizations, that year I start. Mommy, at 9, we do HPV. At 10, cholesterol, triglycerides, and at 11, meningitis, tetanus. Just every time I see them, I remind them, prepare them. Very well taken. Identify the champion. Particularly, this story comes hit me hard in my heart. About 15 years ago, when the HPV came around, I remember one day I walked in a room for a checkup. It was a 9-year-old checkup on a girl. I've known this family since birth, the baby. Even before mommy said good morning, he said, Dr. Rodriguez, I want my daughter vaccinated for HPV today. Remember, this is 15 years ago. I said, well, good, thank you, good idea, good choice. It is approved for 9 and it works well, but we've been recommended it for 11. You can wait if you want to. The mother said, no, Dr. Rodriguez, my older sister died of HPV in her 30s. I want my daughter vaccinated today. Wow, that was a deep human experience. I had to sit down and talk to that mom. And from that day on, I realized the power of prevention, primary prevention, when it hits so close to home. So we decided to start implementing changes, and you can see what the results are in our practice. Transparency, ownership, basic 101 quality improvement, transparency. If you make a mistake, acknowledge it, fix it. Ownership, these are basic 101. And then focus on the process. If you make the process, improvement, the outcomes will come later. And then the most recent, since 2015, 16, 17, we've been doing cycles of improvement on early, like I mentioned, started at 9, and it has been a big success in our practice. So I think I can give the talk because I walk the walk. That's how you say it. I don't know if I have time for a question. Do you have what do you use for surveillance, or better, what does your, okay, thank you. So the question,
So it would be, we do GRIT, and then we also do COCASA, which is run off of GRITs. And then we have reports that we run off of our EHR, the EPIC, for the missed opportunities.
Thank you. If that, no more questions, thank you.
Wow, that's truly amazing, Dr. Rodriguez and Laurie. That really just shows what you can achieve when you have a plan and you're passionate about it. I mean, that the strategies that you've recommended, starting that conversation early, strong recommendations, starting vaccination at 9, it's just incredible. And like you said, in Georgia, we're good at giving vaccines. There's no reason why HPV should be left behind. So I just encourage all of the clinicians today who are joining us just to look at their practice and see ways, just like Dr. Rodriguez did, about ways that they can drive up these vaccination rates. So perfect. With that, I'd like to introduce Ms. Terry Anulowicz next. She is a longtime advocate for HPV awareness and education, and has partnered with us to support legislation and advocacy in the state capitol over the past several years, especially with our Cervical Cancer Awareness Day. We have also partnered with Shay Roberts of District 52 and Kim Schofield of District 60 around Metro Atlanta, who are also strong advocates for HPV awareness. Today, Ms. Anulowicz is joining us. She is a member of the Georgia House of Representatives, where she represents the people of District 42, which includes Smyrna and portions of Marietta. So thank you again, Ms. Anulowicz, for joining us today.
Thank you so much for having me. I'm very glad to be back meeting with. I see a lot of familiar faces. I see a lot of folks who we have recognized in the past as our HPV, as our cervical cancer champions, and worked with on HPV awareness issues. I'm very grateful for the work that all of you are doing, particularly with regards to vaccine hesitancy. And I was also very happy to hear the conversation about talking about the HPV vaccine in conjunction with also, wanting to make sure we can get the COVID-19 vaccine. I actually have a good friend, and my children are part of the Moderna study for vaccine efficacy for the COVID-19 vaccine in adolescence. And a friend of mine wanted to do it with her daughter and got there, and they went through the whole process, and her daughter was getting ready for the jab in her arm. And she said, oh, do the other arm. I just had a shot there last week. And she actually wasn't able to participate in the trial because she had just had her HPV booster. And I think that that is something that I anticipate a lot of parents are going to have a lot of questions about, because I know that we're going to try to be getting shots into arms of our kids, you know, going hopefully by the time school starts this August. So I was really happy to hear that conversation, along with, you know, Representative Roberts is here, Representative Schofield. We have been talking a lot about, you know, ways to increase HPV awareness. You know, we obviously are piggybacking on a lot of the awareness efforts that we've done around cervical cancer, but HPV really is, of course, that's the root cause of all of this. And so, you know, working with working with this community, working with the physicians, working with the advocates, you know, Jana was able to come and speak to the Women's Legislative Caucus last week, which was fantastic, just again, to talk about these cancers that are so pervasive, that impact so many people, and that we know are so completely preventable. So I can let some of my colleagues hop on if they'd like to also.
Good morning. I just wanted to say hello really quick. I'm Representative Shay Roberts from House District 52, which is Sandy Springs, North Atlanta area. Sorry, I was just running from a subcommittee meeting, but I just wanted to say hello, say that I completely support us really pushing to make these issues more aware and make sure that people are getting vaccinated. I know I had my daughter vaccinated when she was 12 and felt very good about knowing that I was protecting her from, you know, potential future cancer. And so there, to me, there is no downside. And now, you know, I've learned through these programs how many other types of cancers it actually can impact. And so it just seems like we should be really spreading the word loud and wide to get both our young ladies and young men vaccinated. So anything I can do to help, I appreciate you having me here today. And appreciate all of your work. Thank you.
And good morning. I think it's still morning. Yeah, I think we've got up early, so we're just ripping and running. But I'm State Representative Kim Schofield. I represent parts of East Point, College Park, Forest Park, Southeast Atlanta, and Hapeville. And I echo my colleagues' words and just will add that this is very important to me. My daughter, who's an older adult daughter now, was definitely vaccinated, and something we stand for. And especially in communities of colors, we really just need to be focused on a vibrant campaign to make sure that all girls know the risks, the factors, the benefits, and parents are educated. So I stand in complete an ally for you to make sure that we can do whatever we can do to help you. You know, you can always count on me. And so I'm working with Representative Anulowicz and Representative Roberts will continue to be on the forefront to advancing ways and things to make it better. So thank you.
Great. Thank you all so much. We know that y'all are extremely busy. And so the fact that you made it here today, it just really speaks volumes to your commitment to this cause. And we really appreciate all your efforts and the ways that you participated. It just highlights how we need support at all levels in the legislature, through health systems, through families to reach our goals of having 80% or more of Georgians vaccinated. So, so with that, I'd like to go on to our next survivor. Again, I think these are some of the most powerful ways that we can understand the impact of how these cancers impact our life. Sorry, I think I might have, before we do that, I think we have a question. So can we put up the question there? Mama. There it is, perfect. Okay, so the question is, what age range is recommended for males and females to receive the HPV vaccine? According to the CDC and the ACIP, the Advisory Committee on Immunization Practices. I believe Dr. Rodriguez had mentioned it. Again, I think I saw it in his talk, and I believe in Dr. Bob's as well too. So was it birth through 2 years old? Oh, we got enough already. Perfect. Yeah, so it's about half and half this time. So the correct answer is actually 9 through 45 years old. So the CDC Advisory Committee recommends that routine vaccination be performed for boys and girls, men and women ages 9 through 26. But through 27 and 45, they do recommend vaccination after having a discussion with your physician about the risks and the benefits of the vaccine. So it's not routine up to age 45, but the CDC does recommend vaccination up through 45, so 9 to 45 years of age. All right, and then getting back on track, sorry I got derailed there. We're now gonna have another survivor, Mr. Kevin Renshaw, who has agreed to share his story. And I hope that these just drive home the point of why it's so important to vaccinate and to eliminate these cancers. And with that, I'd just like to thank you for joining us today, Mr. Renshaw.
Thank you, Dr. Boyce. I appreciate it. I thank everybody for joining this webinar, and a special thanks to all of the healthcare professionals. Everybody has been working tirelessly, not just with their regular jobs, but in the COVID environment. You know, we all thank you for that. You know, my wife and I, we celebrated our 32nd wedding anniversary not too long ago. Jennifer and I met in college. We had a lot of amazing experiences in our life, but I can tell you that few compare to the fear, the uncertainty, the loss of control that comes with a cancer diagnosis. So if you can prevent that, that's an amazing thing to be able to share with people. So I'm always ready to share my story. I share it readily. And I also, my kids joke around that I'm now a Pied Piper for the HPV vaccinations. So before my diagnosis 2 years ago, I was like super boring patient. I mean, I went to my annual physical. I did it every year. I went to the dentist twice a year. I go for annual dermatology screenings. I go to the eye doctor once a year. Like that was my, you know, routine. I hardly ever go to the doc for sick visits, and I always get my flu shot. Moderate exercise, ran a couple of 5Ks. I have many of my relatives that are jealous because my blood pressure is always 120 over 70 something. I mean, I'm really boring as a patient until 2019. So in February 2019, my family, we went on a vacation for a few days down to Florida at the end of February. We came back and we all ended up immediately, you know, going back to school, going back to work. We all got like colds and the sniffles and stuff, and everybody had sore throats and swollen glands and whatnot. But after about 3 weeks, 4 weeks, everybody else's glands were better, and I had a little almond-shaped lump that appeared on the lower right side of my neck, and it hadn't subsided. So I made the appointment, and I had my annual physical coming up. So I went and I pointed it out to my GP towards the end of March it was. And he's like, you know, that doesn't look really appealing. So why don't we get it looked at? Let's go to an ENT. So I went to the ENT, and Dr. Alexander at the ENT group, I mean, he just took a look at it. He was really familiar with what's going on, you know, with the occurrences of throat cancer and HPV. And he said, I need to biopsy that right away. And within 4 days, I was back in his office with the results of that. And then he made the referral to Emory and Winship, the Head and Neck Cancer Center. I met Dr. Boyce and the team, and they were absolutely fantastic. So it went from a vacation to 6 weeks later having a diagnosis and then talking about treatment plans. And it's terrifying. I remember like walking around the house and lying down on my kid's bed, so when no one was home, and crying and just saying out loud, like, you know, I failed you. So I prayed And I talked to people and I listened to my doctors and we got into treatment. And I stayed positive, you know, and I just kept looking each day, one day at a time, conquer the day, conquer the day. So I stayed active. I walked. You know, during my radiation treatments, I directed a play because theater is one of my other activities. And I built the set by myself because I needed something to do to show progress each day. I talked to my family and all of that helps. It's wonderful, it's great. But I'll tell you that cancer is brutal. And throat cancer was really brutal. You know, the front that you put up emotionally to get through each day is just exhausting on top of everything else. So I went from a place where I used to like grouse and complain about going to the doctor for 5 appointments a year. And I was like, oh, well, I don't have time for this, yada, yada. And then all of a sudden, we're talking about 180 days of appointments that I went back and tracked over a 16-month period where I was with some kind of a medical provider. Love all you medical providers, I do. I just don't want to spend 180 days over a 16-month period with you. So diagnosis, 3 surgical procedures, 30 radiations, my hyoid bone splintered, so I had to do 30 days of hyperbaric treatments, physical therapy because my shoulder's locked up, swallowing therapy. I still walk around with my water all the time, and you know, all the follow-up visits, and then my regular stuff with my dentist and the usual things. So 180 doctor visits in 16 months. I went from 215 pounds to 165 pounds. I was pretty sick. The treatment was tremendously successful. And for that, I'm so thankful. I'm thankful to Dr. Boyce. I'm thankful to the entire team at Emory, all the PAs, all the nurses, all of the admin support, everybody who took care of me and my family and friends. My last, most recent PET scans, everything's like, you know, coming up very positive, no sign of recurrence. I'm back to a healthy fighting weight of about 185 pounds or so. So I feel very, very fortunate. You know, I was able to keep working throughout all of this because I'm in sales and I work from home and I travel, and I was able to curtail my travel and still work. So I didn't miss very much work at all. My company was very, very understanding. My boss was extremely accommodating. There was a lot of people who supported me. But as I was going through this experience, I thought about, you know, not everyone can do that. I have family members who don't have that kind of a job. I mean, the folks who are on this call, if you're a health care provider, you couldn't do that. You know, you couldn't work from home. You have to go and, you know, lay hands on people and make them better and work with them. I mean, how do you do a job over the course of a year plus and try to have all these medical appointments? If you work in hospitality, or if you're you know, in-line work on a factory, construction, agriculture. I mean, you know, think about all those folks. I mean, you know, how could you do what I was able to do? I was very fortunate. And I'll tell you that when you think about all of those things, and then you add to that the emotional weight, it gets really complicated when you add income struggles into that world. You know, are you on short-term disability, long-term disability? How do I pay these bills? How do I read these statements? I need to get well. I need to care for my family. I mean, it's a really tall order for anybody. And I think that is just a trying experience that you're trying to get through, no matter how positive you can stay. And even though there's a team of people around you helping you through the process. So we can get vaccinated now. We can protect our kids from getting HPV. I have 2 teenagers. I have a 17-year-old and an 18-year-old. I have a boy and a girl. Both of them were vaccinated before I was ever diagnosed. It was part of our visits with our pediatrician, as we've heard the stories told earlier today. And they said, here's the vaccination schedule. This is the recommendation. Here's what it will prevent. And it's like, you're telling me there's something that will prevent my kids from getting a cancer? Yeah, like sign me up. So we didn't hesitate at all for that. So my kids have been vaccinated. You know, I think back to, you know, most likely, I mean, you know, Jen and I have been married, like I said, for 32 years. You know, I probably contracted HPV when I was in college in the 80s. We were all freaked out about HIV. Didn't even know what HPV was. I mean, I never knew I had it. I didn't have any symptoms. So, I mean, we can protect our kids, right, from that kind of a thing. So we can vaccinate our kids. We can prevent the pain. We can prevent the disruption. We can prevent the fear that comes with cancer, and especially those cancers that are associated with HPV. As I started off saying, I'm really upfront with everybody about my journey. It's cancer. It's cancer from HPV. Have your kids been vaccinated? Will you get them vaccinated? Talk to your pediatrician. And I tell them, whatever you think the downside of vaccination is, it doesn't compare to the brutality of the cancers that we're talking about and the disruption and the fear that it brings into your life. So I'm extremely thankful. I'm healthy. I'm actually traveling for work right now, very minimally and very safe. I feel very fortunate to be where I am today. And I can't thank everybody on this call enough for inviting me to share my story. And thank you for all the work you're doing. HPV can be prevented, so let's prevent it. Thank you so much for the time.
Thank you, Mr. Renshaw. Again, these stories are just so powerful, and we just really appreciate you being vulnerable. And again, I know it's difficult to relive that experience, but by you sharing that, it does persuade others. It does show how important it is to prevent these cancers. It doesn't matter if it's cervical cancer, oropharyngeal cancer, anogenital cancer. All these that are caused by HPV are very difficult, both emotionally and just physically, to get through treatment, diagnosis, and afterwards. So thank you for sharing your story. We are running a little bit over time, and so just to let y'all know, we are coming to a close shortly, just another 5 minutes or so. But next up, and not least, I would like to introduce Mr. Greg Reibold. He is the Vice President of Public Policy and General Counsel for the Georgia Pharmacy Association since 2015. He's going to be discussing a very relevant and current legislative effort underway in Georgia that has the potential to drastically improve immunization access to Georgians. So thank you, Greg, for joining us today.
Yes, thank you, Dr. Boyce, and thank you everyone for being here. I will be brief. I know that y'all are running over and I want to be sensitive to time, but thrilled to be here today to talk about this important issue and excited to report that in the General Assembly currently, and we're in legislative session now, there is a piece of legislation, Senate Bill 46, that's sponsored by Senator and Dr. Dean Burke, and it looks to expand the ability of pharmacists to administer vaccines without individual prescriptions. And so this would allow pharmacists to do certain vaccines pursuant to vaccine protocol agreements with physicians. And under current Georgia law, pharmacists can administer vaccines pursuant to a protocol agreement for flu, pneumonia, meningitis, and shingles. And so what this bill looks to do is expand pharmacists' ability to administer vaccines to all ACIP recommended vaccines for adults, as well as vaccines needed in connection with public health emergencies. So this would increase to include hepatitis A and B, MMR, Tdap, and obviously importantly HPV. And the HPV is something we're super excited about. What makes this bill important? And I think it really boils down to access of care. And Georgia, interestingly, really struggles with sort of medically underserved areas. And in Georgia today, there's approximately 130 medically underserved areas throughout the state. And folks often think, hey, that's rural Georgia. And it can be rural Georgia, but can also be, metro Atlanta. And there can be, in certain ways, healthcare deserts in the heart of the city. And so it's a really interesting thing. And what pharmacies can bring to the table, obviously they've got the training and expertise to administer vaccines, but it's a critical access point. And when you have a vaccine like for HPV that is proven and it works, and it's one of the primary centerpiece tools to prevent cancer, increasing access makes a big difference. And so I think as of February of 2021, the Georgia Board of Pharmacy had roughly 2,200 active licensed retail pharmacies in the state of Georgia. And so obviously, this is going to increase access to the HPV vaccine significantly. I think, additionally, there's a lot of data, and you hear varied data on this, but folks visit pharmacies more than they tend to visit their primary care providers, particularly adults, right? I think parents do probably a better job of making sure their children are getting in to see their pediatricians. And so you see a really good job of children getting the HPV vaccine, I think. But there's numbers as broad as ranging from, hey, your average patient's going to go to the pharmacy 35 times a year versus 4 to 9 to see their primary care provider. And then there's other estimates that make it a little bit less than that. But certainly folks are going to pharmacies more than they're going to their primary care providers. So it's a critical access point. And so what this bill is going to do with regard to HPV specifically is it's going to allow pharmacists to administer the vaccine without a prescription for adults 18 to 26, and then as well as 27 to 45 when there's certain factors present. So it's something we're certainly excited about. The other thing I would point out is during the period of emergency, U.S. Department of Health and Human Services has allowed pharmacists to do ACIP recommended vaccines for children, but only during the period of emergency. And so, but it's an interesting thing because it is, I think, a unique opportunity. We have seen, parents have been probably more hesitant to take their kids to the pediatrician during COVID. And based on some of the statistics we're seeing, it looks like nationally there's a drop of around 13.5% in HPV vaccine administration in 2020 versus 2019. So during this period of emergency, it's, parents can take their kids into the pharmacy to get that vaccine as well. And so did want to point that out, but this is a neat bill. It has, I think, strong bipartisan support. The Georgia Department of Public Health has put a lot of work into this bill as well. The Medical Association of Georgia, the Hospital Association. This is a really good, I think, coalition bill. And it originated in the Senate. It has moved over to the House. And so we're looking forward to having a hearing on that in the coming weeks. I would note there has been some opposition to this bill, and it appears organized by some anti-vaxxer communities and interest groups. And so to the extent that you all are interested in the bill, reaching out to the House Health and Human Services Committee members and letting them know that you support Senate Bill 46, I think would certainly go a long way. And happy to answer any questions, but again, very much appreciate the time and excited for the opportunity to report on Senate Bill 46.
Great. Thank you so much, Greg. Those were amazing statistics. There are many barriers, and just being able to get access to that vaccine is going to be huge. So thank you for your work. I'm excited to see how this bill, as it moves through the House and hopefully becomes ratified. So thank you for that. So we're at the end of our webinar today, and I'd like to draw your attention to our 3 calls to action. So number 1, as Greg just mentioned, would be to support Georgia Senate Bill 46 to reduce barriers to vaccination that will allow pharmacists to provide the HPV vaccine to adults without a prescription. Second is to Georgia Medicaid to provide coverage for the HPV vaccine for both male and females up to age 45, as recommended by the CDC and the ACIP. And then strive for an 80% vaccination rate in Georgia by being an advocate for HPV vaccination in your community, clinic, workspace, and family. So just remember, HPV affects everybody: men, women, old, young, those with wealth, and those with limited resources. So we have the tools available through vaccination to prevent these cancers. We also need more screening to prevent cervical cancer. We need you to spread the word and knowledge about HPV and how it can be stopped. Remember, preventing cancer is better than treating it. So thank you to all of our participants for being a part of our first annual Georgia HPV Awareness Day. I hope that it has been educational and inspired you to make changes to defeat HPV. I would like to thank especially our speakers for today for their time and making this event special. Thank you, Amma, for her help and technical assistance. And if you are interested in joining our work group or learning more about HPV and ways that you can help promote this, you may contact Amma Bawache. Her email is there on the bottom right. Email her. And then please, if you can, connect to our social media pages to learn about the most recent and up-to-date HPV news. So again, thanks again, everybody, and I hope to see you again next year for International HPV Awareness Day. Thanks.